If you're over 60 and struggling with the kind of nights that leave you staring at the ceiling at 2 a.m., I need your full attention for the next few minutes. I'm speaking to you as a physician who works with older adults every week, and I'm going to be very direct, because this one change can transform your nights and your days. Neurologists beg seniors to stop taking over-the-counter PM sleep products and nighttime cold or pain formulas that rely on sedating antihistamines right before bed. That single habit, reaching for a pill that promises drowsiness, is silently wrecking your sleep architecture, fogging your thinking the next day, and raising your risk of falls, urinary retention, constipation, and dangerous drug interactions. I know why you use them. They feel familiar, they're easy to find, and they work in the sense that they make you drowsy. But drowsy is not the same as sleeping well, and the price your brain and body pay is far higher than people realize. Here's the core problem in plain language. The sedating ingredient in most PM formulas is a first-generation antihistamine. It blocks histamine receptors in your brain, the very system your brain uses to maintain a healthy sleep-wake rhythm. When you blunt that system with a drug that isn't truly a sleep medicine, you may fall asleep faster, but you fragment the night, you strip away essential dream and deep sleep stages, and you wake unrefreshed. Worse, these same drugs also block acetylcholine, a neurotransmitter your nervous system relies on for attention, memory, bowel and bladder function, and muscle coordination. That anticholinergic effect is why so many older adults wake groggy, confused, or unsteady after a PM night, why the bathroom becomes a war zone at 3 a.m., and why constipation, dry mouth, blurred vision, or urinary retention show up out of nowhere. If you live with glaucoma, enlarged prostate, chronic constipation, balance issues, or memory concerns, these side effects are not harmless. They're hazardous. There's a second trap hiding in the label. Many nighttime pain, allergy, or cold remedies pair that sedating antihistamine with another ingredient you may not need every night. Some contain pain relievers that, when taken more often than intended, can strain the liver or kidneys. Others combine several compounds that overlap with medicines you already take, raising your total dose unintentionally. You see nighttime and assume safe. But these are kitchen sink cocktails designed to knock you out, not to restore healthy sleep. The next morning proves it. If you wake thick-headed, light-sensitive, a little off balance, and with your mouth like cotton, even when you slept 8 hours, you didn't sleep, you were drugged into a light, unrefreshing doze. Your brain can't run its nightly housekeeping like that, and the bill comes due the next day when names sit on the tip of your tongue, your mood runs thin, and your steps feel less certain. Now let's talk about what happens in the brain at night so you can see why this matters. Healthy sleep cycles through stages every 90 minutes. Light sleep that eases you in, deeper slow-wave sleep that repairs tissues and stabilizes memory, and REM sleep that processes emotion and integrates learning. Your brain orchestrates that cycle with a careful balance of signals: histamine for alertness, GABA for calm, melatonin for timing, acetylcholine for memory, and REM. When you swallow a sedating antihistamine at bedtime, you throw a blanket over the alertness system, but you also scramble acetylcholine. That combination reduces REM, disturbs the transitions between stages, and makes awakenings more likely. The result is a night full of micro-arousals you may not remember, and a morning that feels like you never truly slept. The older we get, the more fragile these transitions become, which is why the same pill that felt harmless at 40 can leave you wrecked at 70. I'm not asking you to tough it out without help. I'm asking you to swap a quick fix that harms you for a plan that supports you. The first piece is to stop using sedating PM antihistamines for sleep. If you need an allergy medicine, talk with your clinician about a non-sedating option you can take earlier in the day, not at bedtime. If pain keeps you up, address the pain with a targeted plan that matches your diagnosis, rather than masking it with a nighttime combo that adds anticholinergics on top. If congestion is the issue, treat the congestion directly with non-sedating strategies and proper timing. You're not giving up comfort. You're choosing methods that don't sabotage your brain's night shift. Your second piece is to reset the 90 minutes before lights out. The human nervous system needs a predictable glide path to sleep, not a crash landing. Start by finishing large fluids at least 2 to 3 hours before bed. You can still sip, but stop loading the bladder late. Take medications that your clinician has scheduled for the evening on time, but ask whether any diuretics, stimulating antidepressants, or activating medicines can be moved earlier. Dim household lights and shift screens to night mode, or better yet, put them away. Blue-white light from LED screens tells your brain it's morning, suppressing your natural melatonin. If you enjoy a warm drink, keep it to 4 or 5 ounces, not a full mug, and choose something gentle that won't spike blood sugar or irritate the stomach. Keep the bedroom cool, dark, and quiet, with an amber nightlight for bathroom trips so you don't blast your eyes awake. Now for the question people ask first, what should I take instead? The answer depends on why you can't sleep. If your problem is timing, your brain isn't getting sleepy until too late. A very low dose of melatonin, taken 2 to 3 hours before your target bedtime, can help nudge the clock in a safer, more physiological way. I'm talking about a fraction of what most over-the-counter gummies contain. Think 0.3 to 1 milligram, not 5 or 10. Higher doses often lead to middle-of-the-night awakenings and morning grogginess. If your problem is racing thoughts, a short wind-down routine that signals safety to your nervous system works better than any pill. 2 slow breaths in through the nose, a long exhale through relaxed lips, repeated 10 times, gentle shoulder rolls, and a minute of soft calf pumping to warm the legs. If aches flare at night, ask your clinician for a pain plan that reduces symptoms in the evening without sedating your brain. If reflux wakes you, adjust meal timing and head-of-bed elevation rather than swallowing a PM formula that aggravates confusion. The most effective strategy older adults can learn is paradoxically simple. If you can't sleep, get out of bed. Your bed must become a place your brain associates only with sleep and intimacy. If you lie awake tossing for more than 20 minutes, your brain learns that bed equals worry. Instead, get up, keep the lights dim and amber, do something quiet and neutral, fold a small pile of towels, read a few pages of a paper book, sit and breathe until your eyelids feel heavy, then return to bed. This single rule prevents the glue between your mind and your mattress from breaking. It also frees you from the clock. Checking the time at 2:17, 3:04, 3:26 wires anxiety. Turn the clock away. If you need an alarm for morning medication, set it and forget it. Another overlooked reason for poor sleep is late-day inactivity. If you sit most of the day, your circadian system gets confused, and your body's drive for deep sleep weakens. You don't need a gym membership to fix this. Aim for light movement most days. 10 minutes after breakfast, 10 minutes after lunch, 10 minutes after dinner. Walk a hallway, loop the living room, or stand at the counter and alternate heel raises with toe raises while you breathe slowly. Daytime motion improves glucose control, lowers evening adrenaline, warms the muscles, and builds the kind of fatigue the brain interprets as good tired. When you pair that with morning daylight, step outside for a few minutes after breakfast even if it's cloudy, you give your internal clock the cues it craves. Day is for light and motion. Night is for cool and dark. Let's talk safety, because this is where neurologists really do beg. Sedating antihistamines worsen balance through 2 mechanisms. They sedate your brain, and they slow your reflexes. Add in nighttime bathroom trips, dark hallways, throw rugs, and stiff ankles, and you have a perfect recipe for falls. Falls at this stage of life are not small. They lead to broken wrists, hips, and heads, and to long detours through hospitals you don't need. On top of that, anticholinergic drugs can tip a vulnerable brain into confusion or delirium, especially in unfamiliar settings or during illness. They slow the gut, so constipation creeps in, and they tighten the bladder, so urine gets trapped, problems that cascade into more nighttime awakenings and more pills. If you're also taking medicines for bladder urgency, vertigo, nausea, or certain mood disorders, your total anticholinergic burden can skyrocket without you realizing it. Keep a current list of every pill, patch, drop, and herbal you use, and let your clinician or pharmacist scan it specifically for anticholinergic load. Reducing that load is one of the fastest ways to clear your thinking and steady your steps. You might ask, but I've used APM pill for years and I'm fine. My response is that you've gotten used to a level of fog and fractured sleep you shouldn't accept. When we taper people off these products, we see smoother nights within days, lighter mornings within a week, and safer balance steadily after. The first 3 or 4 nights can be bumpy. Your brain is recalibrating, but that discomfort is the sign that the system is waking back up. During that week, keep the rest of your routine very predictable. Dim lights at the same time, finish fluids early, practice your wind down, keep the bedroom cool, and use the get out of bed if you can't sleep rule without negotiation. You are training your physiology like you'd train a skittish pet. Calm, consistent signals, not punishment. If you are currently using a sedating antihistamine every night, do not stop abruptly without a plan if you also rely on it for allergy or hives control. Instead, talk with your clinician about switching your allergy care to a non-sedating option used in the daytime and tapering the sedating agent off. If you're using a nighttime pain combination, ask for a targeted pain schedule that doesn't include anticholinergics. If you live with chronic conditions such as Parkinson's, dementia, glaucoma, enlarged prostate, heart rhythm issues, or sleep apnea, it is especially important that you remove sedating antihistamines from your bedtime toolbox. Your brain and body already work harder to coordinate sleep. They don't need a chemical headwind. A word about alcohol, because it's often combined with PM habits. A nightcap feels like a friend because it relaxes you, but it suppresses deep sleep early and rebounds with lighter, more wakeful sleep later. It worsens snoring and apnea, dehydrates you, and adds to middle-of-the-night awakenings. If you drink, keep it with dinner, not near bedtime, and keep the amount small. You will fall asleep a little slower and sleep much better. Caffeine also lingers longer as we age. Many older adults sleep better simply by making noon their caffeine cutoff. Keep your environment on your side. Clear the path to the bathroom and install a dim amber nightlight, not a bright white one. Move frequently used items within easy reach so you don't climb or stretch at night. Secure throw rugs or remove them. Keep your phone face down and away from reach so a late-night buzz doesn't pull you into a scroll you regret. If you share a bed, talk about a shared wind down that respects you both. 2 minutes of synchronized breathing lowers the temperature on a whole household. Now let's give you a 1-week reboot you can start tonight. Night 1 through 3, stop the PM product and set a fixed bedtime and wake time you can keep 7 days straight. Finish big fluids 3 hours before bed. Keep any final sips to a few ounces 90 minutes before. Dim lights an hour before bedtime and put screens away. Sit in a chair with both feet on the floor and take 10 slow breaths. 2 calm inhales through the nose, 1 long exhale through pursed lips, then do 10 gentle ankle pumps to warm your calves and a few shoulder rolls to release tension. Get in bed. If you can't sleep after what feels like 20 minutes, get up, keep it dim, and repeat the breath and ankle sequence, or read something neutral until you feel heavy-eyed. Night 4 and 5. Keep the same schedule and add a short, quiet routine you enjoy in the evening. A warm shower with the bathroom light dimmed, soft music, or a few pages of a paper book. Night 6 and 7. Keep everything the same and add morning daylight exposure for 5 minutes and 10 minutes of light movement after breakfast. You will feel the change most in your mornings first. Clearer, steadier, more yourself. If a bad night slips in, and it will, because life happens, don't make up for it by napping long and late or by going to bed hours early. A brief 20-minute rest before mid-afternoon is fine. Anything more steals pressure from the next night and pushes you back toward the old pattern. Keep the same bedtime and wake time, even after a rough night. You're teaching your internal clock what you expect. It will adjust. Some of you will worry that without a PM pill you'll simply lie there miserable, and you're tempted to reach for something natural but unregulated. My counsel is to be cautious. Supplements are often dosed far higher than the body needs and can interact with your medicines. If you want a bridge while you reset, discuss a tiny, time-appropriate dose of melatonin with your clinician, taken hours before bed, not at lights out. Some older adults also do well with a small evening serving of protein at dinner and a warm, very small beverage 60 to 90 minutes before bed to prevent a blood sugar dip that can wake you, but the volume must be modest to protect your sleep. These are gentle nudges, not sledgehammers. Daytime choices make nighttime easier. Keep bowels regular with fiber, fluids earlier in the day, and movement. Constipation makes nights uncomfortable and raises the risk you'll reach for a PM combo that worsens the problem. Manage pain preventatively, not reactively at midnight. Treat reflux with meal timing and position. Time diuretics earlier when your clinician agrees. These small shifts remove the dominoes that make a 2 a.m. pharmacy raid feel necessary. The reason neurologists sound so urgent about this is simple. Your brain is the organ that most depends on healthy sleep, and it's the organ most hurt by anticholinergic sedating shortcuts. Better sleep is not a luxury at this stage. It's how your memory, mood, balance, and blood pressure stay steady. When you stop taking PM pills and rebuild a sane bedtime routine, you're not just chasing a better night. You're protecting tomorrow's conversation with your granddaughter, tomorrow's trip to the market, tomorrow's walk with a friend. You're also protecting yourself from preventable emergencies. Nothing ruins a month faster than a fall in a dark hallway after a drugged night's sleep. If you're ready to act, here's your simple commitment. Tonight, put the PM bottle in a hard-to-reach cabinet. Set your bedtime and wake time. Finish big drinks earlier. Dim the lights 90 minutes before sleep. Do your 10 calm breaths and ankle pumps. Get in bed. If you can't sleep, get up until you're drowsy, then return. In the morning, step outside for light and take an easy 5 to 10 minute walk inside or out. Repeat for a week. Tell your clinician what you've changed so your medication list reflects reality and so they can help you adjust anything that needs adjusting. If you still feel stuck after that week, ask about a short course of targeted behavioral sleep coaching. It's the gold standard for insomnia at every age, and it works without the side effects. You don't need to earn your sleep by suffering, and you don't need to chase it with a pill that makes tomorrow harder. Your brain wants to sleep well. Give it the chance by removing the one habit that blocks the door. Neurologists beg seniors to stop using sedating PM products at bedtime, not to take something away from you, but to give something back. Genuine restorative sleep and the clear, steady days that follow. Trade the quick fix for a real fix. Start tonight, keep it simple, and let your body prove to you how much better it can feel when the night is finally on your side.